Psoriasis.
Introduction. What is psoriasis? Psoriasis is a skin disease that causes red, itchy, scaly patches, most commonly on the knees, elbows, trunk, and scalp. There is several types of psoriasis. Plaque psoriasis. The most common form, plaque psoriasis, causes dry, raised, red skin patches covered with silvery scales. The plaques might be itchy or tender, and there may be few or many. They usually appear on elbows, knees, lower back, and scalp. Nail psoriasis. Psoriasis can affect fingernails and toenails, causing pitting, abnormal nail growth, and discoloration. Psoriatic nails might loosen and separate from the nail bed. Severe cases may cause the nail to crumble. Gutted psoriasis. This type primarily affects young adults and children. It's usually triggered by a bacterial infection such as strep throat. It's marked by small, drop-shaped, scaling lesions on the trunk, arms, or leg. Inverse psoriasis. This mainly affects the skin folds of the groin, buttocks, and breast. Inverse psoriasis causes smooth patches of red skin that worsen with friction and sweating. Fungal infections may trigger this type of psoriasis. Pustular psoriasis. This rare form of psoriasis causes clearly defined pus-filled lesions that occur in widespread patches or in smaller areas on the palm of the hands or the sole of the feet. Erythrodermic psoriasis. The least common type of psoriasis. Erythrodermic psoriasis can cover your entire body with a red, peeling rash that can itch or burn intensely. Psoriatic arthritis. Psoriatic arthritis causes swollen, painful joints that are typical of arthritis. Sometimes the joint symptoms are the first or only symptom or sign of psoriasis, and at times only nail changes are seen. Symptoms range from mild to severe, and psoriatic arthritis can affect any joint. It can cause stiffness and progressive joint damage that in the most serious cases may lead to permanent joint damage. Common psoriasis triggers include infection such as strep throat or skin infection. Second, weather, especially cold, dry conditions. Third, injury to the skin such as a cut or scrap, a bug bite, or a severe sunburn. Fourth, stress. Fifth, smoking or exposure to secondhand smoke. 6. Heavy alcohol consumption. 7. Certain medication including lithium, high blood pressure medication, and anti-malarial drug. 8. Rapid withdrawal of oral or systemic corticosteroids. Risk factors. Anyone can develop psoriasis. These factors can increase your risk. Family history. The condition runs in families. Having one parent with psoriasis increases your risk of getting the disease, and having two parents with psoriasis increases your risk even more. Secondly, stress. Because stress can impact your immune system, high stress level may increase your risk of psoriasis. Thirdly, smoking. Smoking tobacco not only increases your risk of psoriasis, but also may increase the severity of the disease. Smoking may also play a role in the initial development of the disease. Psoriasis treatments aim to stop skin cells from growing so quickly and to remove scales. There are options for topical therapy like creams, ointments, or gels.
Creams.
Hi! Welcome to Berta Pharmacy!
Hi, my hands have been itching. I think I have psoriasis.
Oh, is it psoriasis? Can I check it for you? Oh yeah, I have checked that it is psoriasis. So let me list you some good creams that are available in our pharmacy. So wait a minute.
The first cream is Betnovate cream. Betnovate contains 0.1% weight over weight beta-methasone 17 valerate and 0.1% chlorocresol as preservative in water miscible cream. It is a potent topical corticosteroid that is used for adults and child over 1 year for the relief of the inflammatory and pruritic manifestation of steroid-responsive dermatosis. So how to apply Betnovate cream? It should be applied thinly and gently rubbed in using only enough to cover the entire affected area once or twice daily for up to 4 weeks until improvement occurs, then reduce the frequency of treatment or change to less potent preparation. Contraindications when using Betnovate. The first one is untreated cutaneous infection, then pruritus without inflammation, rosacea, preanal and genital pruritus, acne vulgaris, puerperal dermatitis, and dermatosis in infant under 1 year of age, including dermatitis. Special precaution for Betnovate. It should be used with caution in patients with history of local hypersensitivity to corticosteroids or to any of the excipients in the preparation. For use in children, in infants and children under 12 years of age, long-term continuous topical corticosteroid therapy should be avoided where possible as adrenal suppression can occur. The adverse reaction for betamethasone are pruritus, local skin burning and skin pain, and it must be stored below 30 degrees Celsius.
Next, the cream that we can recommend to you that is available in our pharmacy is Dermovate 0.05% cream. Dermovate is a very potent topical corticosteroid indicated for adults, the elderly, and children over 1 year for the relief of the inflammatory and pruritic manifestation of steroid-responsive dermatosis. The active ingredient of this cream is clobetasol propionate. Clobetasol is in a class of medications called corticosteroid. Corticosteroid works by activating natural substances in the skin to reduce swelling, redness, and itching. The other ingredients contained in this cream is glyceryl monosterate, cetosterol alcohol, chlorocresol, which acts as a preservative to avoid microbial growth, sodium citrate, purified water, beeswax, propylene glycol, and citric acid. These conditions should not be treated with Dermovate cream. First, untreated cutaneous infections. Second, rosacea. Rosacea is a condition that causes blushing or flushing on the face. Next, acne vulgaris, pruritus without inflammation, perianal and genital pruritus, and lastly, puerperal dermatitis. It is a red rash that circles our mouth. The special precautions that you should follow if you're using this cream is it should be used with caution in patients with a history of local hypersensitivity to corticosteroid or to any of the excipients in the preparation. This cream is very easy to use. Just apply thinly and gently rub in, using only enough to cover the entire affected area once or twice a day for up to 4 weeks until improvement occurs. Then, reduce the frequency of application or change the treatment to a less potent preparation. Don't forget to wash your hands before and after applying this cream. For the storage, this cream should be stored below 30 degrees Celsius. This cream is only for external use. Do not let this cream get into your eyes or mouth and do not swallow it. Keep out of reach of the children.
Next, hydrocortisone 1% cream. So, hydrocortisone cream is a mild corticosteroid indicated for irritant and to treat swelling as well as itching. So, there are a few precautions when using hydrocortisone cream. Firstly, to avoid prolonged use, as this may cause permanent stretch marks, bruising, or even discoloration. Secondly, use with caution in pregnant women. Tell the doctor if you are pregnant or may be pregnant. Ask for the doctor's advice for suitability. Then, avoid using hydrocortisone cream over large areas, especially in areas where the skin is thinner or when an occlusive dressing is present. Also, do not use on broken or infected skin, including cold sores, acne, and athlete's foot. So, the contraindications when using hydrocortisone cream is that it may cause bacterial infections on the skin, viral infections on the skin, fungal infections on the skin, or even hypersensitivity to the active substance. Next, the administration of hydrocortisone cream.
To administer hydrocortisone cream, one should apply sparingly to the affected area 2 to 4 times daily and reduce the frequency of application gradually as improvement occurs and eventually discontinue. Once applied, do not cover the area with a dressing or plaster. The advice that needs to be given to a patient are hydrocortisone cream should only be for external use only and to keep out of reach of children. How do we store hydrocortisone cream? So, hydrocortisone cream should be stored at a temperature below 30 degrees Celsius. And therefore, when using hydrocortisone cream, if the condition has not improved after 7 days or becomes worse, one should consult a doctor.
Gel.
Slowly kisses passing by.
Hi, how are you today?
Hello, no, I don't feel so good.
How can I help you?
Currently, the doctor has diagnosed me with psoriasis and he gave me the ointment for me to apply on my skin. However, the skin got irritated every time I apply it. Can you suggest any other types of medicine that is suitable for me?
I have two suggestions of gel medicine for you, such as Tazarotine gel and DERMALEX gel.
Can you explain each of these gels?
Yes, sure.
DERMALEX Scalp Psoriasis Treatment Gel. Uses of DERMALEX gel are: first, helps in the restoration of the skin barrier and the formation of a protective layer on top of the skin to keep moisture in. Second, help reduce patching, scaling and itching and stimulates the skin's own repair mechanism. And third, helps normalize skin cell production, tackling the cause of the disease. The ingredients of DERMALEX gel are alkaline earth mineral complex, optimized for scalp psoriasis treatment, modified aluminosilicates, glycerol, cellulose gum, octyl-dodecanol, phytosinosin, dehydroacetic acid, benzoyl alcohol, and purified water. For the side effect, although the majority of people do not have any adverse effects when taking this drug, you may feel a little burning sensation on your skin. This might be due to the lotion's high concentration of alkali earth minerals. How to use this gel? First, push the hair away as much as possible. Second, apply to your scalp and spread the gel in a swirling motion with your fingertips. And third, let it dry and do not wash out until your next shower or bath. You can use the gel twice a day and in the morning and the evening. For the storage, store this gel at room temperature below 25 degrees Celsius. Hazards and caution. First, for external use only. Do not use on open wounds. Keep out of the reach and sight of children. Suitable for long-term use as long as symptoms persist. And the last one, in the unlikely event of any skin reaction or allergy, please discontinue use.
The second gel medicine that can be used to treat psoriasis is Tazarotine gel. What is the use of Tazarotine gel? Tazarotine gel is a prescription medicine used to treat the symptoms of psoriasis and acne vulgaris. The ingredients of Tazarotine gel are Tazarotine as the active ingredient, ascorbic acid, benzyl alcohol, butylated hydroxyanisole, butylated hydroxytoluene, carbomer homopolymer type B, additive disodium, hexylene glycol, poloxamer 407, polyethylene glycol 400, polysorbate 4D, purified water, and tromethamine as the additives. What are the side effects that may occur when using Tazarotine gel? The side effects that may occur are itching, redness, irritation, burning, dry skin, peeling, and last but not least, scaling. How do we apply Tazarotine gel? Firstly, if you apply shower before applying Tazarotine gel, your skin should be dry before applying the gel. Then, you may use a cream or lotion to soften or moisten your skin at least 1 hour before you apply Tazarotine gel. Lastly, apply a thin layer of Tazarotine gel to cover only the psoriasis lesions. How do we storage Tazarotine gel? Store Tazorac gel at 20 degrees Celsius to 25 degrees Celsius and keep Tazorac gel out of reach of children. Contraindications. Tazorac gel is contraindicated in pregnancy as retinoids may cause fatal harm when administered to a pregnant female, and individuals who have known with hypersensitivity to any of its components.
Ointment!
Morning, Mr. Mo. Welcome here. How about you today?
Good morning. Today I am feeling good.
I heard you have been suffering from the psoriasis disease. So how long you have been suffering from disease?
So I've been suffering for psoriasis for almost 4 years.
That's quite long. So how did you do to treat the disease?
So for the to treat the disease, I use some ointment.
Sorry, what's that?
Wait a minute!
Did you know, apart from cream and gel, the treatment for psoriasis can also be available in the form of ointment. So, we have chosen the two ointment products that are commonly used to treat psoriasis disease, which is first, namely, psoriasis and Divobat.
Psoriasis Deep Moisturizing Ointment. The active ingredient is coal tar 2% and the inactive ingredients are ethanol, light mineral oil, petrolatum, polysorbate. The uses of psoriasis Deep Moisturizing Ointment is it can relieve psoriasis symptoms at their origin, reducing itching, flaking, redness, and other psoriasis-related discomfort. It penetrates the skin while the rich moisturizing components combine to build a barrier to lock in moisture for hours, making it ideal for nightly usage. Psoriasis Deep Moisturizing Ointment will help reduce psoriasis symptoms and restore your skin to a more natural appearance. The side effect is it may increase your skin's sensitivity to the sun or sun lamps, so you must wear sunscreen and limit your exposure to the sun as much as possible. Therapy may have a varied effect on each individual. If you suspect that this drug is producing adverse effects, see your doctor or pharmacist. He or she can assist you in determining whether or not the medicine is causing the problem. How to apply? First, wash the affected area. Second, use a tiny amount and just apply it to the affected areas. Third, after administering the medication, wash your hands, unless, of course, you administered the medication to your hands. Advices to patient: stop using and contact a doctor if the condition does not improve after regular use of this product as described. Use caution when exposing your skin to sunlight after using this product, as it may increase your risk of sunburn for up to 24 hours. Keep out of children's reach. Keep out of children's reach if ingested. Seek medical help or contact a poison control center right away. Storage. This medicine, like other drugs, should be kept at room temperature. It should be kept in a safe place away from extreme heat, dampness, and direct sunshine. Keep it out of the reach of children. Make certain that any leftovers are properly disposed of.
Now, the second ointment we choose is Divobat. Active ingredients in this ointment contains calcipotriol 50 microgram, which act as hydrate, and beta-metasone 0.5 mg, which act as dipropionate. The excipients contain liquid paraffin. It contains all-red alpha tocopherol, polyoxypyridine stearyl ether, which contains butyl hydroxytoluene, all-red alpha tocopherol, white soft paraffin, which also contains all-red alpha tocopherol. Divobat ointment is for initial topical treatment of stable plaque psoriasis vulgaris amenable to topical therapy. However, the ointment is hypersensitivity to the active substance or to any of the excipients. In addition, due to the content of calcipotriol, Divobat is contraindicated in patients with known disorders of calcium metabolism. Besides, due to the content of corticosteroid, Divobat is contraindicated in the following conditions: viral, for example, herpes or varicella, lesions of the skin, fungal or bacterial skin infections, parasitic infections, skin manifestations in relation to tuberculosis, rosacea, perioral dermatitis, acne vulgaris, atrophic skin, striated atrophicae, fragility of skin veins, ichthyosis, acne rosacea, ulcers and wounds. Diabetes is also contraindicated in erythrodermic, exfoliative and pustular psoriasis. So how the direction to use this ointment? Diabetes should be applied to affected areas once daily, and the recommended treatment period are 4 weeks. If it is necessary to continue or restart treatment after 4 weeks, treatment should be continued after medical review and under regular medical supervision. What you want to know when you are using calcipotriol containing medicinal products. The maximum daily dose should not exceed 50 grams, and the body surface area treated with the calcipotriol containing medicinal product should not exceed 30%. For pediatric population, the safety and efficacy of diabetic ointment in children below 18 years have not been established because current available data in children aged 12 to 17 years old are described on side effect and pharmacology with pharmacodynamic interaction, but no recommendation on posology can be made. While for usage in pregnancy, there are no adequate data from the use of diabetic in pregnant women. Studies in animals with glucocorticoids have shown reproductive toxicity, but a number of epidemiological studies with less than 300 pregnancy outcomes have not revealed congenital anomalies among infants born to women treated with corticosteroid during pregnancy. The potential risk for humans is uncurtailed. Therefore, during pregnancy, diabetes should be only used when the potential benefit justifies the potential risk. And for breastfeeding, betamethasone passes into breast milk, but risk of an adverse effect on the infant seems unlikely with therapeutic doses. There are no data on the excretion of calcipotriol in breast milk. Caution should be exercised when prescribing Diavorbec to women who breastfeed. The patient should be instructed not to use Diavorbec ointment on the breast when breastfeeding. For infertility, studies in rat with oral doses of calcipotriol or betamethasone dipropionate demonstrated that no impairment of male and female fertility. Next, for caution of Diavorbec ointment usage, its incompatibilities is not to be mixed with other medicinal products. For side effect of this Diavorbec ointment, the most frequently reported adverse reactions during treatment are various skin reactions like pruritus and skin exfoliation. The following adverse reactions are considered to be related to the pharmacological classes of calcipotriol and betamethasone respectively. For calcipotriol, adverse reactions include application site reactions, pruritus, skin irritation, burning and stinging sensation, dry skin, erythema, rash, dermatitis, eczema, psoriasis aggravated, photosensitivity and hypersensitivity reactions, including very rare cases of angioedema and facial edema. Systemic effects of the topical use may appear very rarely and causing hypercalcemia or hypercalciuria. And last but not least, the storage of this Diavorbec ointment do not store about 30 degrees Celsius. Its shelf life is unopened container for 2 years, and after first opening of its container is just 1 year.
Comparison!
For comparison, ointment retain on the skin for a longer time and provide occlusive layer. For cream stay on the skin longer than gel but shorter than ointment because it absorbs faster into the skin. And for gel stay on the skin for a short time because it absorbs faster into the skin. Ointment prevent from moisture loss better than cream and gel, but cream less effective to retain moisture than ointment. And for gel, not suitable for moisturizing skin because of its texture. The duration of the drug release become greater for ointment, but for the cream, the drug release on the site of the application is smaller than ointment but higher than gel. For gel, the drug release on the site of the application is smaller than cream and ointment. In conclusion, ointment is the best option for people to use to treat psoriasis.
Thank you for watching. Bye!